Chapter 30, Hematologic Disorders. The list of the red blood cell disorders that we're going to talk about today are polycythemia vera, aplastic anemia, autoimmune hemolytic anemia, iron deficiency anemia, and pernicious anemia. Polycythemia vera is a condition in which there's too many RBCs that are being produced in the body. What are the symptoms? You're gonna have headache, dizziness, ringing in the ears, blurred vision, and then that ruddy or reddish complexion. That one we have to remember because they love asking that reddish complexion for your polycythemia vera. So if you have too many RBCs that are being produced in the body, blood gets a little more viscous or a little thicker, right? So you could think of like all the risks that could happen. Like there's a risk for blood clots, right? Because the blood is really thick. So how do we treat this? We treat this by removing that 1 unit of blood, or what we call phlebotomize, right? So what they do is just like in a regular blood draw, they will insert a needle in that antecubital, and then they will remove 1 unit of blood. They will take it off to make sure that the patient's hematocrit level is normal. And this procedure is usually done in a blood bank. The only difference is that, when you try to donate blood, they could give it to somebody else. Right? For the patient that has polycythemia vera, the blood that we remove from these patients, we cannot donate it to another person. Okay. Aplastic anemia is a condition where there is a complete failure of the bone marrow. And from what we have learned before, the bone marrow is the site where this red blood cell is being produced, the white blood cell, the platelet. So if there's a complete failure of the bone marrow, the patient is going to have low red blood cell, low white blood cell, and low platelet. But if you remember the function of these things, then you're going to remember what will be the symptoms, the signs and symptoms that the patient is going to manifest. For example, what is the function of red blood cell? Well, this is the one that is carrying that hemoglobin and that oxygen to the body, and that carbon dioxide from the lungs, from the tissues to the lungs to out of the body. White blood cell is the one that is responsible for infection, to combat infection. Platelet is the one that is actually helping for clotting, right, to control bleeding. So if you have low levels of these things, then of course you're going to have problem with, maybe a patient is going to have some shortness of breath. White blood cell patient is going to have that frequent infection. Platelet patients is going to have that risk for spontaneous bleeding, right? So that's why it makes sense for these signs and symptoms. If you look at it, signs and symptoms: pallor, extreme fatigue from the low red blood cell, low oxygen in the body, tachycardia because the body is trying to compensate from that low RBC, shortness of breath, hypotension, prolonged or spontaneous bleeding, and frequent infection. Okay, what is causing aplastic anemia? Well, there are some drugs that actually could cause this. That's the side effect of this drug. When we um, talked about, during pharmacology, we talk about some drugs that actually has this side effect, and that's why we're monitoring the patients for like infections and bleeding. So certain drugs like streptomycin and chloramphenicol, or sometimes, exposure to like toxic chemicals and then the radiations. However, in some cases, the reason is unknown. So, how do we treat this? Depends on the reason. If we know the reason, then we correct it. If it's the drugs, then we try to stop it and then we get an order for something else that could replace those drugs. Um, but on those cases that we don't know the reasons, we usually do symptom management. Um, the patient is going to have like transfusions to replace those low red blood cells, those low white blood cells, and platelets. We also give them antibiotics because we did talk about the frequent infections, and corticosteroid also could help. And if it gets really bad, then we have to do bone marrow transplant. Autoimmune hemolytic anemia. In this condition, the bone marrow is not the one that is having the complete failure to function. Bone marrow is totally fine. It makes adequate amounts of the blood cells. But the problem starts when those blood cells gets released into the circulation because as soon as they get released, it gets destroyed. So you're going to have symptoms like pallor, extreme fatigue, tachycardia, shortness of breath, and hypotension. And then jaundice. Jaundice is because, once the RBC, in a normal situation, once the RBC has done its job, it gets back to the liver, and then after 120 days, it needs to be, destroyed and reabsorbed into the body, whatever body can use. However, when RBCs are being destroyed, there's this compound that is being released, and it's called bilirubin. And this is the one that makes those skin yellow, makes those skin itchy, and we call them jaundice. This is from the RBC that are getting destroyed. So again, go back to the function of the RBC. If it gets destroyed once it's being released in the circulation, now it's not going to be able to do its job where it's going to bring those oxygen to the tissues and all of those things. That's why you're going to have these signs and symptoms. So what are causes of autoimmune hemolytic anemia? Well, in some cases, again, it's unknown. However, causes that we know are certain infections like drug reactions, again, there's some certain cancers, and then if the newborn of a mother that has a Rh negative and that the baby is Rh positive, then that is going to be a problem, and it causes this hemolytic anemia. And then the test that we use for the autoimmune hemolytic anemia is what we call positive direct Coombs antiglobulin tests that they do in the lab. Treatment, we try to identify and treat the cause. So if we know the cause, we can do something about it, right? Like we said, if it's an infection, then you can treat the infection. If it's drugs, then we can do something about it. Also, we give the patient corticosteroids, or we can give them blood transfusion to replace those red blood cells. Iron deficiency anemia is caused from diet that is too low in iron, or the body is not absorbing enough iron from the GI tract. And why is this important? Iron is important because it's needed for the production of hemoglobin. So if you have low iron and you don't have enough to be able to produce hemoglobin, you're going to have a problem with low hemoglobin, low red blood cells, low hematocrit, in addition to you having that low serum iron. And we know what are the functions of the red blood cells and hemoglobin, right? So you're going to have signs and symptoms like fatigue, pallor, orthostatic changes, like when the BP actually changes from The patient is laying down to sitting up and then sitting up to standing up. How do we treat this condition? Well, we give them iron supplements. If we can give those iron tablets to the patient or those liquid, or we can actually educate the patient to have foods high in iron, like your liver, oysters, red meats, fish, dried foods, legumes, dark green vegetables, and iron-rich grains. Pernicious anemia is when the body is not absorbing vitamin B12 due to the lack of intrinsic factor. So hold on, let me put a little drawing here. This is your esophagus and then your stomach. And then this would be your small intestine. So intrinsic factor is a substance that is being made in the stomach and it is needed for the vitamin B12. B12. Hold on. Okay. So again, the intrinsic factor that is being produced in the stomach is needed for the reabsorption or the absorption of your vitamin B12 here in the intestine, okay? So if you don't have this substance or there's a lack of this substance, then the body's not going to be able to absorb vitamin B12 properly. And why is vitamin B12 important? Vitamin B12 is not only helping with the normal functioning of the brain and the nervous system, but it also is needed for the formation of red blood cells. So if you don't have it, then you're gonna have problem producing red blood cells. Okay, so now you're gonna have symptoms like your fatigue, pallor, weakness, and remember this sore tongue and numbness of hands and feet. Highlight those signs and symptoms. Okay. How do we treat pernicious anemia? Well, we treat it by replacing what is missing. We give them the vitamin B12 medication or what we call cyanocobalamin. So if it's just something that we can correct by giving patient that vitamin B12 via like a medicate, like a tablet, like a pill, then we can give that. If not, or those patients that has neurologic symptoms, then we actually have to give them a monthly intramuscular IM injection of your vitamin B12. Sickle cell anemia is when the red blood cells are having this weird shape. It's a misshapen red blood cells. That's why we call it sickle cell. I'll show you the picture in the next slide. But because of this weird shape of the red blood cell, the body is not able to do its function properly. So you're gonna have signs and symptoms like fatigue, jaundice, from the high bilirubin from the red blood cells that is being destroyed, and then cardiomegaly. The heart is going to be enlarged because it's trying to compensate from that low red blood cell in the body, and then tachycardia, same thing. This disorder is a recessive genetic disease, almost exclusively in African Americans. Recessive gene meaning both the mother and the father needs to be carriers for this disorder to actually, manifest. Sickle cell crisis. Hold on. We'll talk about sickle cell crisis in the next slide. But this is what I was talking about earlier. Is these are like regular shapes of your RBCs. It's biconcave. It's shaped like this. With your sickle cell anemia, it the RBCs look like this. Some of them even look like S. Some of them are like this, okay? So if the RBCs are shaped like this, then it's going to look like this in the blood vessels, right? They're not going to be able to flow properly or smoothly in the blood vessels. Therefore, when this happens, when it's like occluding some blood vessels, sickle cell crisis happens. We call it sickle cell crisis, okay? This is very painful. So your patient is going to have severe pain, and it varies depending on what area is affected. Okay, your patient is going to have fever as well. And please remember that for your sickle cell crisis, there is a trigger. Okay, triggers could be dehydration, infection, overexertion, cold weather changes, excessive alcohol consumption, and smoking. So, if you're taking care of a patient that has a sickle cell and they keep having this sickle cell crisis, it's very important for us to understand what is causing that, because go back to the triggers. Something is triggering the sickle cell crisis of this patient, and we have to do something about it. We have to educate the patient. We have to make sure that the infection, for example, or dehydration is being corrected, so that it's not going to happen. How do we treat? There's no treatment for sickle cell crisis, or sickle cell. What we do is symptom based. So pain management, like I said, signs and symptoms is very, very painful for the patient. So we make sure that we're doing a good pain control. If it's dehydration, then we're gonna give also your IV fluids, correct the situation, um, red blood cell transfusions to replace those sickled or misshapen red blood cells, oxygen to make sure that there's enough oxygen, sufficient oxygen, that we're giving to the tissues, body tissues, and then this medication, hydroxyurea, is actually helping with sickle cell. Okay, so we're done with the red blood cell disorders. Now let's go to the coagulation disorders, which are your thrombocytopenia, your disseminated intravascular coagulation, and hemophilia. Thrombocytopenia is a condition where there is too few platelets. So go back to the function of platelets. Then you're gonna know if there's a thrombocytopenia, which is too few platelets. You're gonna have those signs and symptoms of like bleeding. Okay, that's why patients can have petechiae and purpura, those two things that we did talk about in the previous chapter. Those tiny dots of tiny red dots in the skin of the patients. That's your petechiae, and purpura is just a little bigger from the petechiae. Patient is gonna have gingival bleeding, nose bleeding, epistaxis, unusual or prolonged bleeding. So, what is the common cause of thrombocytopenia? Most common cause is from chemotherapy or radiation, because it's kind of like destroying those bone marrows that is producing the platelets. How do we treat thrombocytopenia? Well, we do a platelet transfusion, correct what is, or replace what is not in the body. DIC, or disseminated intravascular coagulation, is a condition where there is a hypercoagulable state or abnormally increased blood clotting. So in a normal situation, when the skin is cut, the person is going to have that bleeding and the platelets and the clotting factors is going to be activated, and there's going to be a coagulation cascade. In DIC, there is an overstimulation of this normal coagulation cascade. Common cause is usually secondary to another pathologic process like sepsis, shock, major trauma, crush injuries, burns, cancer, acute tumor lysis syndrome, or obstetric complications. So how do we treat this condition? We can give or do this blood component replacement, maybe give them the platelets and the clotting factors, or heparin. Heparin is given to prescribe to interrupt that DIC cycle, what's going on, and then it's kind of like letting the body reset, allowing the body to replenish that platelets and the clotting factor. However, it says in here based on physician orders, because some physicians actually don't believe in this replacement of blood component, because they believe that if we give more platelets or more clotting factors to the patient that is having DIC, it's going to exacerbate or make it worse rather than it helps the patients. So based on physician's orders, but those are things that we actually can or do if the physician prefers. Okay, hemophilia is a genetic disease that is caused by some lack of the blood clotting factors. When we talked about the previous chapter, we were talking about all those clotting factors. And with your hemophilia, there's like some factors that are missing. So for your hemophilia A, the factor 8 is the one that is missing. For hemophilia B, factor 9 is the one that's missing. Okay. So for this disease, this is a genetic disease. The woman is a carrier. The woman will carry the trait and then will pass it to their son. Okay, and then the son is the one that is going to show or have those manifestations of the disorder. So signs and symptoms, if you're missing your factor 8 or you're missing factor 9, you're missing some of your clotting factors, then you're going to have uncontrolled bleeding. Treatment, there is no cure. However, what we can do is we can help the patient manage the symptoms or manage it. We can give what we call fresh frozen plasma, or we can even give them what we call cryoprecipitate, which is a transfusion. This is to replace those missing blood factors. And if the patient is also in pain, then we make sure that we're giving them or we're providing a proper pain control. And that concludes chapter 30.